Well, hello, everyone. Thanks for waiting with us. Dr. Apandi, one of our panelists, is having a little bit of difficulty connecting from Kenya, and hopefully she'll be with us shortly. So we may have a little pause here as we adjust, but let me go ahead and introduce myself and our conversation for today, and hopefully Dr. Apandi will be able to connect and the internet will cooperate for us all shortly. So thank you for joining us today. My name is Rachel Vreeman. I am a pediatrician and HIV researcher who actually does research primarily related to adolescents who are living with HIV. And most of my career has been spent doing work in Kenya and elsewhere in East Africa related to the challenges that adolescents who are growing up with HIV face. So our topic today is really near and dear to my heart. As you may know, if you've joined us from these prior conversations, the Arnhold Institute for Global Health at Mount Sinai and the Department of Global Health within the Icahn School of Medicine at Mount Sinai have been hosting these conversations around COVID-19 and issues tied to global health, particularly trying to have a global perspective, even as we very much talk about a pandemic that's impacting us here in New York City very actively. So we're excited to be able to share part of that further with us today. I have the privilege of being the chair of the Department of Global Health at Mount Sinai, as well as the director of the Arnhold Institute. And that has particular benefits in things like today, where I get to talk to a few of my heroes who are taking care of adolescents and who are global experts in what that looks like. And we can explore together the impact that this pandemic is having on adolescents around the world. I'm so glad that we have Dr. Apandi joining us now as well successfully, as well as Dr. Angela Diaz today. So let me tell you a little bit about our two speakers a moment. So Dr. Edith Apandi is a pediatrician who specializes in the care of adolescents, who works in Kenya at the Moi Teaching and Referral Hospital. She has been involved in the clinical care of people living with HIV since 2005 through a consortium called the Academic Model Providing Access to Healthcare, or AMPATH. She started working with AMPATH early in her training in Kenya and continues, and now is actually the pediatrician in charge of the pediatric and adolescent HIV care that AMPATH provides. AMPATH is a partnership between a consortium of North American medical schools that includes Mount Sinai and the Moi University School of Medicine in Kenya and the Moi Teaching and Referral Hospital. In the program that Dr. Apandi is managing and that she will describe more, she actually supervises over 300 facilities providing care in Western Kenya and is directly in charge of taking care of more than 6,000 children who are living with HIV and 2,500 adolescents who are between the ages of 15 and 19. She also is instrumental in bringing up the first adolescent-focused health clinic in Kenya and has a passion for what it looks like to grow adolescent health in sub-Saharan Africa in particular. She conducts research related to the care of children and adolescents who are growing up with HIV. She serves as the secretary of the AMPATH Pediatric Working Group, which helps to support a number of research protocols taking place in Kenya and in East Africa around HIV-focused and adolescent-focused issues. And she also serves in a key advisory role in the Kenya National HIV/AIDS Pediatric and Adolescent Technical Working Group. So we're so grateful to have you joining us today from Kenya, Dr. Apandi, and it's great to see you there. We also are equally delighted to have Dr. Angela Diaz joining us from New York City today. Dr. Diaz is the Jean and James Crystal Professor of Adolescent Health in the Department of Pediatrics and in the Department of Environmental Medicine and Public Health here at the Icahn School of Medicine at Mount Sinai. She earned her medical degree at Columbia University, completed her postdoctoral training at Mount Sinai, and subsequently received both a master's in public health from Harvard University and a PhD in epidemiology from Columbia University. Dr. Diaz is the director of the Mount Sinai Adolescent Health Center, which is a unique program that provides high quality, comprehensive, multidisciplinary primary care to adolescents or teens, all of which is free for those without insurance. And under her leadership, this center has become the largest adolescent-specific health center in the United States. And I think speaking from our global work, and hopefully she'll be describing this model for us more, it really is a model for all of us considering global adolescent health work in other places. The Adolescent Health Center here serves more than 12,000 vulnerable and disadvantaged youth in New York, including those who are uninsured and who may otherwise lack access to health services. And their program really attempts to address health disparities and aim for health equity, as well as wellness and prevention for teens. Dr. Diaz is a member of the National Academy of Medicine, where she serves on its governing council. She's been a White House fellow. She reviews grants for lots of federal agencies. And in her leadership roles, she's also been a member of the board of directors of the New York City Department of Health and Mental Hygiene, and president and chair of the board of trustees for the Children's Aid Society of New York. So Dr. Diaz is also active in public policy and advocacy internationally, as well as here in the United States. And I'm so excited to bring together for a little bit of time today these global experts to help us consider how we can best respond to the needs of adolescents during this current pandemic, and especially how that can be informed by what we've learned through years of caring for adolescents in the HIV epidemic as well. I'd like to note that I'm very aware that with the three of us, we all are speaking from physician perspectives on this, and we're excited to be following up, hopefully in a few weeks, with hearing adolescent voices about this as well. So while I'm sorry we don't have adolescents with us at the moment, please know that your voices are going to be heard in this as well, and we hope that will come in. So we'll talk from the care perspective a bit more today, and we'll dig in more from the community perspective and youth perspective in the near future, we hope. So thank you to both of you for joining us. I'd love it if you could both start with sharing a bit about what your respective organizations do, and how the patients that they serve, and how your patients are affected right now as we've been moving through this COVID pandemic. So maybe Dr. Diaz, we'll start with you and then move to Dr. Apandi after that.
Thank you so much, Rachel. I'm really excited to be part of this conference. This presentation is really exciting, and to learn more about Kenya and the wonderful work that you guys are doing there. So as you heard, the Mount Sinai Adolescent Health Center was created in 1968. So we are around for 52 years. Thank you to many wonderful supporters and friends that we have all over the globe, actually. And every year we serve over 12,000 young people, ages 10 to 26. We provide high quality, comprehensive, integrated medical services, so we're their medical doctors, sex and reproductive health, dental, optical, health education, behavior and mental health, as well as legal services. Most of our young people come from low income backgrounds, and most have no health insurance. So all our services are provided at no cost to all the patients, and we pay for all their laboratory tests, their medication, and we give them Metro cards for transportation. Our patients have been affected by the pandemic in the following ways. And what we did was that starting in May 1st, we started surveying our patients. So I'm going to be sharing some of what we are finding that they are reporting to us. So in terms of the actual infection, 16% of our young people said they knew they had been exposed to the virus. Less than 3% had been tested. And of those that were tested, 44% had no symptoms, and 30% had 3 or more symptoms. About 30% reported that they had lost relatives or other loved ones. That's a huge amount of losses for young people. I don't know how they are, surviving that. In terms of the social determinants of health, 66% reported that someone from their household had lost their job. 32% reported that they were having really difficulty just getting food and paying rent. 30% of them said that they had to go out to work because they're essential workers, and if they don't work, they do not eat and cannot pay the rent. They have no choice but to go out and work. Many reported that they did not have enough food in their home, and 20% had gone and gotten food from churches and food pantry. 50% reported losing other sources of financial support like food stamps, and 3% reported losing their housing and becoming homeless. And in terms of adolescent development, unusual structure, the way that young people traditionally spend their time, with school closed, no after-school programs, no sports, and no opportunity for young people to socialize physically with their friends, and no rituals such as middle school graduation, high school graduation, attending prom. You know, young people are just feeling isolated and out of their elements. And for many of them, their dreams had been just put on hold. Young people need a place where their emerging needs can be addressed, their question answered, where they feel seen and heard, and where they can feel supported. The Mount Sinai Adolescent Health Center decided to play that role during these really difficult times for them. So we decided to remain open during the pandemic. We have been open Monday through Saturday, and we have physician on call at night and on Sundays. So young people have access to us at all time. And this has been really important because many of the places that serve young people had to close for in-person services. So not only are we seeing our own patients, but we are seeing patients that traditionally get seen by somebody else. And the young people are so thankful. They can just keep saying thank you for us for being there for them. And we are really providing essential services.
Yeah, absolutely. Wow. And that's, you know, I think to consider I mean, of course, as we've said, you know, the Adolescent Health Center really is such an incredible model for what it can look like to provide all these different services and support for such a vulnerable population. And then to start to hear that this population is in fact impacted in so many ways, so intensely, in terms of the losses and traumas, all the different changes that they're going through and the potential needs around that. I think there's a lot we can keep talking about in that. And you know, with that, I'm incredibly grateful too that you were able to stay open and to provide ongoing support in this time when it is so needed along those lines. Dr. Apandi, let's turn to you for a moment. Again, thanks for joining us, and we'll hope that your connection holds for us so we can stay on. If you want to unmute yourself, I'd love to hear if you could explain a bit for our group about your organizations and the patients you serve, perhaps particularly focusing on the Refugee Clinic in Kenya and what that Adolescent Health Center provides, who you help to take care of, and then you can also start to talk too about how this pandemic has been impacting those services and your patients as well. I think let's see, you're still muted on here. I'm not sure, I think I can help you maybe. Are you able to get it unmuted? Hopefully we won't lose her here. All right, bear with us for a moment. In global health, we are frequently have to be very adaptable in our connections and our technology. Everyone else has been learning that lesson as we've gone through our pandemic social distancing, but we hopefully managed to make this work here. It seems like maybe her connection froze a little bit. I mean, I guess I don't want to speak for Dr. Apandi. I will note, I think she'll be reconnecting here in a moment. Dr. Apandi and I have had a privilege of working together in Kenya over the last 15 years, and the work to bring up this adolescent health clinic has been one that has been the dream of her heart, I would say, and grown that way. Excellent. We see you now again, Apandi, and are you?
Yeah.
Oh, and
Sorry,
we can hear you. Perfect.
Okay.
Well, tell us about Refugee. Oh, hopefully we'll continue. Oh, no. Our internet is not cooperating with us. So we'll note that in the Refugee Center that Dr. Apandi has been able to bring up, much of it has been built on the framework of beginning to provide first a system to provide HIV care in this setting, and then from the resources that have been available for HIV care in settings like Kenya, using that infrastructure to then begin to address other chronic diseases, and also the idea even of providing care for adolescents in a way that is specific, that falls between children or what you do in pediatric services and how services for adults are otherwise shaped and structured. And in an interesting way, that evolution out of the HIV care response in settings across East Africa has created a platform for us to grow the idea of adolescent medicine and really kind of learn from principles of adolescent health provision, like Dr. Diaz's clinic, in terms of how you might shape a clinic to specifically meet the needs of adolescents, why they have specific needs, why specific care is important for them, and so on. We'll move back to her, I think, as soon as she's able to reconnect. But so Dr. Diaz, turning back to you a little bit, could you tell us a little bit more about how the adolescents that you serve may be particularly vulnerable in this pandemic as it's really surrounded us in New York City, whether it's from their social circumstances, their health circumstances, their economic circumstances, and so on, kind of how these vulnerabilities, what they are, what have been particular challenges for them in the pandemic a bit more.
Yeah, thank you, Rachel. I want to emphasize that our priority during the pandemic has been to keep our patients safe and healthy, and the staff safe and healthy.
Sure.
So that's the priority, but at the same time, try to meet the increasing needs of our community. So we have approached this in a number of ways. What we did was that we communicated with our young people through MyChart, which is the patient portal of our electronic medical record. So we send them communication basically saying, if you can stay home, please stay home. But if you have a need that cannot wait, we want you to know that we are open here 24/7 for in your behalf. Some of the young people who came, they came because they had symptoms of the virus or wanted to be tested. Others came with medical conditions from respiratory to abdominal problem and abdominal complaint. We have been able to really reassure them, provide those services that they need, and keep them from going to really busy, overwhelmed emergency rooms.
Sure.
They should not be going to for a number of reasons. And also we have been able to keep them from needing to be admitted. For example, for chlamydia. If they have chlamydia, the most common bacterial sexually related infection, if they have it, we can just give them some antibiotic tablets here with water right in the clinic, and they are treated, and they will get cured. If they don't have access to treatment and services, that will become pelvic inflammatory disease. They can get very sick, and they may need to be admitted. And we know what is happening in the hospital. They should not be there. What we did with our clinic is that we divided our medical staff into different teams. Team A, B, and C. And one of those teams is always covering the clinic. And then if team A is in the clinic, B and C are working from home.
Mhm.
We also have health educators and mental health people in the clinic in case those patients coming and need those services. But what we did was that we set up most of our mental health staff to working from home through telehealth. And that includes a social worker, psychologist, child and adolescent psychiatrist. And they are working through telehealth. And some of the patients do not have those devices to do that, a few of them, but they are worried about confidentiality. So they are going to use the phone. They use the phone and sometimes they go into the bathroom so that they can have privacy. So we do whatever it takes. And in the first month, we had over 2,000 visits. In terms of the vulnerability of our patients, you know, we have young people, as I mentioned, very low income, no insurance, already people with tremendous disparities associated with poverty, with race and ethnicity discrimination. Our youth, just to give you the big picture of who they are, many of them are immigrants. 70% have no health insurance at all, even though they are so low income. Their families have no health insurance and are not connected to health care. So when people are told, if you get symptoms, call your providers, they have no provider to call.
Sure.
These are the families with the chronic conditions such as asthma, high blood pressure, obesity, diabetes that we know put them at higher risk. These are the families living in very small apartments, sometimes sharing rooms, sharing bathroom, and sometimes multiple families within a small apartment, so they cannot keep away from each other. These are the families who have been disproportionately affected by COVID because they cannot stay home, as I mentioned before. They have to go out and work in order to be able to eat and pay rent. These are the families that our patients and their families get paid very low wages. And these are the families working in places where they work in crowded conditions and they cannot really keep the social distance of a minimum of 6 feet. It's really hard to do that. And these are the families that often lose their job when their employer needs to close or need to reduce their staff. And also, these are the families who cannot benefit from the infusion of resources that the federal government had given to communities, because even though they work, they may not have social security number, or even though if they're eligible, they may not know what to do and may not have the support to really go through those systems. We also treat young people who are HIV positive, and we know that them and any other person with immune deficiency affected conditions are at higher risk. So we are really trying to have, spread out the red carpet for those youth, keeping them healthy. We are providing a lot of pre-exposure prophylaxis and post-exposure prophylaxis to prevent HIV condition. And then the last thing that I will say is that another group of young people is those who are pregnant. We have a prenatal program. And what we had to do was that we bought blood pressure and other equipment for each of those patients and taught them how to take their own blood pressure and how to use the equipment so that we can do as much as we can by telehealth and seeing the reading to the telehealth and helping them. And also we are doing groups, support group and educational groups so that they can support each other and they can learn. And if they need to come in person, we will see them in person. We are here also. Thank you.
Wow. Oh, thank you. It's really inspiring to hear about all you've been able to do and adapt in those ways. And as you've described so well, so many different populations within that group that really need you and are really having such a difficult time right now as well. Dr. Apandi, we're so glad that you are back and I hope working. Let me turn it to you to describe really whatever you would like while we have you, but especially about the Refugee Adolescent Health Center in Kenya, the population of youth that you are working with, and then you start to describe how the pandemic and efforts for prevention around the pandemic have been impacting families in Kenya as well.
Okay, thank you so much, Rachel. So Refugee Clinic was started in 2016. It's much younger clinic compared to the one in New York. And basically, it started because we noticed that the children who are living with HIV, who we were serving in the pediatric care clinics, were not feeling at home in that clinic anymore. They needed to move to a different clinic, and they were not yet ready to go to the adult clinic. So it started with the adolescents living with HIV as the main focus. But because also they did not want to be seen to be attending an HIV associated clinic, we had to open it up to all the adolescents. And so it's a clinic that serves not just the adolescents living with HIV. So we have about 1,400 adolescents living with HIV, 10 to 24 years. We only enroll new adolescents if they are younger than 19 years. But the ones who are already with us, then because of the process of transitioning, we take them up to 24 years. Mm-hmm. We also have to take care of street youth. We have about 100 who are regular, but then we have a huge number who are walk-ins. We also have youth who are from the LGBTQ community. They are not very many, but we do offer them targeted services like PrEP services and mental health support. And then we also have adolescents who work in for sexual and reproductive health services. And we have adolescents who work in because they need mental health screening or support. So that's basically the kind of youth that we serve. We have adolescents who work in just to spend some time in the clinic or maybe do some short social activities like dancing or beading and other social activities. And when they come there, we are able to do health education sessions with them and promote uptake of various services like maybe condom promotion, contraceptive promotion and all that. Mm-hmm. So how we were affected by the pandemic, we haven't had COVID cases in our area. We have had 2 adult COVID cases, and these cases, one was managed very far from our center, and one was managed within the region, but it was not even admitted, so was being taken care of from home. We have not had any adolescent case in my center. We have had, I think we know of one pediatric case who died but had other comorbidities. There are a few other adolescents who have been affected, but I think they're less than 10 in the whole country. So the COVID situation has affected us not in terms of having cases, but in terms of the kind of government policies that have come to deal with it. So we have like curfew. We are supposed to be at home by 7 p.m. in the whole country. And then we also have restricted movements in and out of certain hotspots, mainly in Nairobi, and then we have some in Mombasa and other hotspots in terms of counties. But in my county, we do not have, it's not a hotspot county, so our movement in and out of the county is not restricted. So in terms of how the adolescents were affected, we had reduced access to clinical services because of the restrictions that were put. One of it is because once they travel, you have to travel within the 12 hours that are allowed. And because of that, there was a bit of fear of movement among people in general, and of course, adolescents being part of that. And that fear of movement was because you don't know if you'll be caught out of the house by 7 p.m. But also there was a bit of police harassment, especially at the beginning of the implementation of that kind of policy. So this fear of movement also was because adolescents didn't know, and this is general population, but adolescents are in it, a fear of being found to have fever because there's all this screening all over the place. So you might be found with a cough or a fever, and that might make you be put in some situation where you are maybe being suspected a case, and so it's just very complicated. So many people avoided movement, and so because of that, we want to come, even though they were due to come for drug refills or even for viral load reviews and other care. We also have had an increase in cost of traveling because of the 1 meter thing. So the public transportation could only take a certain number of people at a go. And so they had to increase their prices to meet their daily. And also of the 1 meter thing, we had a lot of times to travel. And this some access to the health facility. Apart from that, we also had clinics being closed. A number of, especially.
Oh no. I think we lost Dr. Apandi a moment. I'm sure she will be rejoining us in just a moment, but I think, you know, what she's describing in terms of, though, you know, there have not been as many cases of COVID in Western Kenya. She was saying in this specific area where Moi University is and where the Moi Teaching and Referral Hospital is, the impacts of travel restrictions and how it's not just the ability to travel, but also how that raises costs, how the public transportation is not available in the way that it would be, in that curfews and police harassment around them could create issues. Dr. Apandi, you are back.
I'm so sorry, I don't know why my internet is this way today.
We understand, we're flexible with it. So, and maybe if you want to continue describing as you were about some of the impact on the access to the clinical care, and then we'll go from there.
Okay.
We'll let you finish.
Yeah, so we had, okay. So we had some of our clinics being closed and some will just be open for a few hours. And some had fewer staffing because of people are trying to limit the number of people who are in a certain space. And so because of that, you'd find clinics where somebody walks into the clinic and they can't receive the service that they were supposed to receive. And then because of the loss of jobs, just like in the US and all that, we have some of our adolescents who have had to relocate or even just move from a certain level of housing to a cheaper one. And so they have to adjust to a new environment. And some of our adolescents have had to change caregivers. Maybe you are living with a certain aunt and now that aunt is not able to keep you. So you have to change to a new caregiver. And this is causing a little bit of anxiety. And then we also have had this issue of having to put up together in one house, maybe as relatives or as friends, and therefore having the issues of lack of privacy for taking medications for adolescents who are on HIV medications. And then again, we had to stop some of the services that make our adolescent clinic adolescent friendly. So services such as psychological counseling, which generally in Kenya is not very much available, but we have been lucky to have that kind of service in our clinic. So counseling was not possible. You can't counsel somebody at 1 meter wearing a mask and not touching the person. So that kind of service was affected. We had to stop group sessions, including multidisciplinary patient reviews. We had to stop them. We also had to stop all our social activities like the dancing, the beading. We had to basically not allow adolescents to hang around the clinic, which is something we had worked so hard to encourage, so that they are around us and they are able to talk to us and get the information that they need. And then again, like the US, of course, we've had some of our adolescents who have been out of school are losing jobs. And so we have them moving from a vulnerable situation to an extremely vulnerable situation. Yeah.
Can you tell us a little more about the specific ways that we worry about adolescents who are living with HIV right now, Dr. Apandi? As Dr. Diaz mentioned, I don't know if you heard, that we of course worry about their immune suppression, their immune suppressed patients, and as I think most of us heard, people with any sort of immune suppression are likely at higher risk if they do get infected with COVID. But I know, of course, there are some other things we really worry about in terms of their access to medicines and their ability to take the medicines. And so can you tell us a little more about why that's so critical for adolescents and maybe why we're so worried about the adolescents living with HIV right now as well?
I'm worried especially about death. The first time this COVID situation came up, the first thing that really worried me and gave me many sleepless nights was death. And basically because we had a lot of adolescents who were near death, and we were trying to work hard to get them out of that situation. And the COVID situation just made all those interventions we were doing difficult. This includes changing their regimens. We were not able to change their regimens because for you to change the regimen, you have to have a very long discussion, and you have to involve many teams. And so we have postponed that for a number of our adolescents. So it means that they are going to be getting even more immunosuppressed. And that is something that really, really scared everybody in the clinic.
Yeah.
The other thing that...
Go ahead.
Okay. The other thing that worries us is the issue of development or accumulation of resistance among that same group. Even if they don't get to the point of death, a number of them have been on failing regimens we have some women have been failing for 2 years and 3 years, and we're in this process of like trying to really change them quickly. But now that has been halted by all this situation. And so I think that even if they come back and we are able to change their regimens, they are going to likely need very complex medications. And our adolescents, as you know, you and I know, once you put them on complex medications, unlike adults who might be able to cope better, they are not able to cope with these many pills and many dosings in a day. And so I'm really worried that as we get to the need for more complex regimens, we are going to be losing more adolescents in the near future.
Yeah, and I think the urgency of what Dr. Apandi is saying in terms of how much she and those of us involved in this worry about the deaths of our adolescents who are living with HIV right now, as people listening may be aware, with medications to treat HIV in this current day and age, HIV really can become something that you can live with for a long time, that can be managed effectively as a chronic disease. But for adolescents, particularly for adolescents who are born with HIV and who have grown up through that, HIV remains the top cause of death for adolescents in sub-Saharan Africa. And we still lose lots and lots of adolescents every year. Our adolescent population is very clinically fragile. And so as Dr. Apandi is really describing, we worry that anytime they can't access care, they can't access medicines easily, where care is being delayed, where she said, they're trying to manage these patients who are kind of hovering around being stable versus not stable and at risk of death. We worry that they'll be sick and very, very quickly and in serious ways that too often is still leading to deaths among our adolescents. So these issues of how effectively you can access the kind of complex care systems that have been set up for them in Kenya right now really does concern us in this active way with that. And then, of course, we add on, these particular challenges that adolescents face acutely in terms of being separated from their peer support, separated from their school situations or other places where they're interacting with peers, the types of counseling and peer groups that clinics are sometimes able to provide. Dr. Diaz, I know that the Adolescent Health Center really has an enormous capacity, normally at least, for providing mental health care services, and that you've really tried to maintain that and to meet increased demands for that during this time. Can you help us understand a bit more what some of these mental health challenges that adolescents are wrestling with right now, and maybe why they're particularly wrestling during this kind of pandemic and social distancing era, and then how you're able to offer some support or strategies for helping them get through this particularly?
Thank you, Rachel. I want to start by saying that our young people prior to the pandemic have very high rates of trauma, post-traumatic stress disorder, anxiety in general, depression, suicidality.
Mhm.
So they have really massive mental health needs. So we have a large mental health program that we
Sure.
want to help them with. On top of that, I'm going to share with you what we found from the survey that we did with 350 just as of May 1st. What they are saying is that because of the pandemic, in addition to the 30% that I mentioned lost loved one, that is a major amount of losses, 65% said that they are feeling more stress on top of their ongoing stress, really much more stressed and anxious. They are saying that they feel fearful, that their worries overwhelm them, and that they can concentrate on very little other than the anxiety itself. Adolescent and young adults report having increased depression. And before the pandemic, we have many who are depressed, and they have increased depression. And we actually administer during this survey a metric, a measure that actually diagnosed depression, and 36% were consistent with clinical depression. That's a huge amount. The other major issue that they reported, I mentioned that many of them had trauma prior to the pandemic, but 6.5% of them said that they're experiencing intimate partner violence. 5% are witnessing violence within their household. 5% said that they were expected to have sex in exchange from food that they needed, shelter that they needed, money, and drugs. And another additional 3% were demanded to send photographs of themselves in order to get those things that they needed. 4% said that they were pressured or forced to have sex. So basically they were raped. So a lot of interpersonal thing. So needless to say, the mental health services have been more important than ever. And through telehealth, we have been able to do intake, to do assessment, to do psychiatric consultation, and to do their ongoing psychotherapy. So we are doing individual psychotherapy. We do a lot of group therapy. We also work with families, family therapy. So all that is very important. I think any modality that people use is great. They just need those psychotherapy. But in particularly, they need trauma-focused or trauma-specific therapies, such as trauma-focused cognitive behavioral therapy, dialectical behavioral therapy. They also need the additional work because of the grief and losses, the bereavement interventions. And I think adolescents can also benefit from mind-body work, meditation, yoga, sleeping well, eating healthy, keeping physically, moving physically, and also they need to learn skills on how to manage their anxiety and how to stay relaxed. And they obviously need to be physically isolated, but within that, they need to really be engaged and to feel connected emotionally, culturally, spiritually. It's really, the socialization is so key to young people that we need to figure out how to do that. They really need to be connected. They're social beings.
Absolutely, absolutely. Dr. Apandi, first, of course, if you want to add anything as you're thinking about mental health challenges for the adolescents in Kenya as well. Another question I had for you, kind of building on that, was because you do research and in our partnership with how to improve HIV-related care for adolescents, I was curious as well if you could describe some of the questions that are coming out when you think about it from a research standpoint as well, things that we need to try to answer to better serve the needs of adolescents right now as well. But certainly if you want to talk about mental health as well, I think that is that in the social context cannot be given enough attention right now with how urgent it is. Nope, and I'm afraid you're muted, so we need to have you unmute.
Sorry.
No problem, there you are.
Okay, so I can say that we also are observing, we don't have numbers, but we are observing increase in especially anxiety amongst our adolescents. Some of them have openly expressed the anxiety, especially when initially people thought that with COVID, then if you have HIV, then you're at high risk of death. And so some of them would express saying that they fear they're not going to make it through the epidemic, and they are wondering if we can change their regimen to more potent regimens. Or some had even stopped their drugs, but now they were coming back and saying, I think I need my drugs because if I get this disease, I'm sure I'll not make it. And of course, some are just anxious because of the other issues going on, like their parents losing their jobs. They do not know if they have food tomorrow. And some are experiencing violence as well, the older ones who are having partners. And so the mental health aspect, I think, is really critical in terms of how to support them. And for us, I feel like it's been a really long walk with our adolescents to just get them to feel human again and to be to enjoy life. And so I fear that this situation might take us a few steps back in that regard. And so getting support that can maintain them, their mental health, I think would be really key at this point and after. In terms of, the other thing that was worrying me that I wanted to mention is that I worry that the number of adolescents who are shifting from poverty to extreme poverty might overwhelm us in the next few months to come. A number of them had been supported through the years through various funds, including the USAID funds and all that, and they had come out of it. But this situation is like, because the ones living with HIV are extremely vulnerable, and this situation is taking us back there some years where we had already moved. So yeah, that's something that maybe as programming for HIV moves forward, it's because that kind of funding had gone down over the years with the people thinking that now HIV has normalized and all that, but this might take us back a few years.
Sure.
So in terms of research, I'm keen. I don't think there's anything strange in my thinking. I think everybody's thinking around the same areas of research, but one key area I wanted to mention was modeling for other chronic diseases to see the impact of COVID on their indicators. And if I just give an example of HIV, I feel like we might get a new peak in terms of new infections, especially among young people and especially among young women for our setting and the LGBTQ community. I just, so if there could be some modeling and ways of seeing how that can be brought down as fast as possible, and also modeling for the kind of mortalities to expect because some of the mortalities will not happen during the COVID period. I think like quite a chunk of it will happen after, but the cause is this COVID period. So if, I don't know if modeling is even the word, but I suspect that you understand what I'm saying.
Sure.
And then of course, I would be interested in research around telemedicine and how that can be supported so that I think if we ever have other epidemics, and even to ease our congestion in the clinics, because we know that after this COVID period, we are going to have everybody needing to come and needing all sorts of services, and we are going to be thoroughly overwhelmed. So any research around cost effectiveness or acceptability, sustainability. In Kenya, we have a very good phone penetration, but then in terms of internet access, we have a bit of challenge with the internet access. So things that if we can see this, if it is even a sustainable move, especially for adolescents. They're always on their phone, but they don't have the resources. They have to be supported to access the resources. And then, of course, mental health and sexual and reproductive health, all these things, they're not unique, but I feel like these are the areas of research we need to look into.
Yeah, absolutely. You know, and I'm really struck in what both of you are describing in terms of how these are already really vulnerable group. It's a really vulnerable group that have experienced lots of traumas already, lots of mental health challenges, lots of insecurity in terms of the financial stability of their family or their own, household unit and whatever that looks like, housing, food, their jobs. And then on top of this, we're adding these new traumas, particularly with so many losses of loved ones, as we're describing here. And I think the economic impact that both in New York and in Kenya is really being felt. I know too in Kenya there's been major flooding recently as well, which is of course another barrier to being able to travel and access care, and of course destroying people's livelihoods as well. Let's turn for a minute. So I neglected to mention this, but there is a question and answer box that anyone joining us is welcome to put questions into. And for the last portion of the hour here, I'd like to try to address some of these questions that people have been putting in. So feel free to type a question into the box if you have one. Dr. Diaz, I have a question from these for you that was one I wanted to ask. I'll start with you, and then we can also ask Dr. Pandey as well. There's a question about whether there are particular new challenges and threats to sexual health for adolescents that are being brought out by COVID that you've seen, and perhaps how you're able to respond to that from a care aspect. I know you've mentioned a few of those, but maybe you can touch upon some of the sexual health challenges and how we're trying to respond to those as well.
Yeah, we were lucky that New York State designated sex and reproductive health as an essential service, the way it should have been. Mm-hmm. And though patients are presently coming from asking from emergency contraceptions that tell you that they are having intercourse, because otherwise, why would they need emergency contraception? They're also coming for other family planning, like the Depo-Provera shot that they need to take at certain intervals. They are coming for long-acting contraceptive and LARC. They are also coming for pregnancy testing. They are coming for testing and treatment for sexually transmitted infections, testing and treatment for HIV. So they are coming for a lot of, and also if they have abnormal labs, they come for that, for transgender health. We have over 600 youth that we have transitioned, and they need their shots if they're in that process, so they come for that. Those things are really important. And we have a teen parenting program for young people that have children. So if their children are sick, they're bringing them. So they're coming for a number of reasons. And I think that it has really been important. And for youth, sexual and reproductive health, as well as mental well-being, are really cornerstone of adolescent health. So we are doing the full range of services of young people to try to prevent their pregnancy. And I think something important to know is that prior to the pandemic, we had achieved the lowest teen pregnancy rates in the US since we started recording that in the 1940s.
Wow. Yeah.
So we need to continue to make sure, otherwise all those gains will be reversed. And a young person that is not seeking pregnancy, for example, should have the tools and the support to prevent that pregnancy. And if they want to have a child, it's a different story. But that's one of the major reasons that I think it's good to be open. And so we're really happy to be here for them.
Absolutely. There are a few questions in the box related to so any challenges you may have had with PPE, with keeping your staff safe during this time, how you were able to keep these essential services accessible and going during the COVID period, and whether there has been any federal funding or emergency support for you in that process as well. I think we all know what a massive challenge that has been, and how much that has hit you would be helpful to hear about too.
So our program, we actually raise all the money because we provide free services, and we know in the US usually that's not what hospital clinics do, but we think that's what really the teenagers that we serve need. But unfortunately, because we are part of a larger system, we have not been eligible directly for some of those resources from the federal government as of now. Things may change. So what we did very early in when we knew this pandemic was coming was that we bought a lot of supply. So we had enough supplies for the staff. And as soon as the patient comes through the door, there is there's a physician or another provider really in full gear, screening the patients at the door. Mm-hmm. And if they have symptoms of COVID, they are putting isolation right away. And our medical director has done a wonderful job managing this. So we have been able to do this, and at the same time do not have many staff who are sick. And we have bought all our supplies so far. And one of the major things that I'm doing personally is really trying to fundraise as much as we can, because this pandemic is going to have an impact of millions of dollars just on our program. And I want to make sure that as through the pandemic and afterwards, we have the resources to remain strong and perhaps even expand, because the needs are going to be larger, especially in sexual reproductive health and mental health.
Sure. Dr. Apandi, there's a question I think you might be best positioned to ask in terms of, whether you have ideas for how telemedicine or teleconsultation could be used further, particularly with some of the adolescents who are living with HIV, in terms of facilitating changes of regimens or those things. I know for us in the United States, as well as in Kenya, this is pushing us to make jumps in what we're able to do with telehealth. And perhaps you could comment on that a bit more as well, of course, if you have ideas for how that might impact sexual health or reproductive health services too. And I think we need you to unmute again, I'm afraid.
Okay.
Thanks.
Yeah, so one of the biggest challenge about telemedicine with HIV in terms of acceptability is the privacy around it, and especially for us here, and I hear even from Professor Diaz, it might be an issue with adolescents living in small spaces and maybe many people in a room. And so that will be like my greatest worry, having a safe space where that can happen. But I think that if it can happen, especially for the smaller facilities where constantly we have maybe a healthcare worker coming from one facility to review a patient in another facility, then the patients could just go to the facility. They could be like maybe the way we conduct support groups, where we have a number of adolescents discussing their issues and learning from one another. I feel like that might be like one of the earliest easy uses that we can do. So because like issues like them disliking certain pills, or certain pills making them have certain adverse events and how they are going through it, things like the challenges they are receiving from school and tips on how to live in a boarding school, they usually do that in a group session. And I feel like attending the group sessions can happen in a safe space in several clinics, with having one healthcare worker and maybe some peer mentors be the moderators of the meeting. In terms of having it at home, I feel like in our setting, it might not be ideal. But again, research can help us to see if that is an option for some.
I'm very cognizant that we've reached the end of our hour, but this has been so wonderful to talk with both of you, and I thank you again for your time today. Before we close, I wondered if we could have each of you take a moment to kind of share a final thought or message, perhaps especially a message of hope. I'm aware we've talked about a lot of the challenges in the current situation, and despite these many challenges and vulnerabilities that we absolutely need to consider and shine light upon for adolescents and young people. I would love to hear your final thoughts as we look to the future with, of course, a group that are our future, and how we can support that. Dr. Diaz, would you be willing to offer your last thoughts first, and then we'll turn to Dr. Apandi?
Sure. People often talk about going back to prior to the pandemic, and I hope that we don't go back in terms of the healthcare delivery system to what we were prior to the pandemic. We have seen the gaps. So I think we should really visualize the ideal health system to help all people and make sure that everyone is connected and have health insurance. And for young people themselves to have team-friendly, developmentally appropriate interventions that really help them thrive and reach the promise of adolescence.
Absolutely. Thank you. I hope so. I hope so too. Dr. Apandi, last thoughts from you?
I think one of the things that make me happier about the timing of the COVID situation is that adolescent health was starting to be fairly recognized in my country. And even at the moment, we have a lot of, not a lot, but we have a bit of adolescent targeted like Twitter messages trending, or in Facebook, and even in the newspapers. People are really talking about what's happening among the adolescents. And I feel like if this COVID came some years back, like 5 years back, we would not even be getting that kind of attention around adolescents. So I think that things are moving up for adolescents, and I think from here we can only move higher.
Great. Thank you so much. Thank you both of you for joining us in the midst of these busy times, and where you're both playing such a critical role for adolescents and young people in our settings. We will be posting the recording of today's session, so please feel free, anyone joining us, to share that, and you can look for that. We'll be posting it and sending that around with a link that usually we have within 24 hours of posting. Again, we thank you so much for your time today, and for everyone who's joined us, we thank you for listening. Next week, our COVID and Global Health webinar is actually focusing on resilience in the COVID-19 pandemic. We're excited to welcome next week on Tuesday the Dean of the Icahn School of Medicine at Mount Sinai, Dean Dennis Charney, who is, in addition to his role as dean, a psychiatrist and longtime researcher related to PTSD and resilience, and how those can be enhanced. So we look forward to talking with him as well in this time, and we'd encourage people to join us next week, Tuesday, for that discussion as well. Thank you to everyone again, and we will connect again soon. Thank you.
Thank you, Rachel. And thank you.